All right, hi, my name is Alexis Polinchek. I'm conducting an oral history interview as a part of the effort to archive the effects of the COVID-19 pandemic on individuals and communities in the Midwest for both the Chippewa Valley COVID-19 Archive and the Journal of the Plague Year COVID-19 Archive. The date is November 24th, 2020, and the time is 11:21. For current statistics on COVID-19, according to the Center for Disease Control and Prevention, in the United States, there have been over 12 million cases and around 256,000 deaths. In Minnesota, there have been 270,157 cases and 3,297 deaths because of COVID-19. All right, so we'll just get this started. What's your name, and do you mind sharing demographic information for the study, such as your race, ethnicity, age, and gender?
Sure. My name is Amy Burgoyne. I'm 49, female, and white.
All right.
Mhm.
What are the primary things you do on a day-to-day basis?
Um, Basically, I work as a franchisee of a large quick service restaurant, and I have two locations. So that takes a lot of my time. And then, other than that, I'm just at home with my dogs and my husband. So that's what I've been doing.
Okay. Where do you live, and what is it like to live there?
Okay. I live in Isanti, Minnesota, a small town, probably population like 7,000, I think, around there. So it's a smaller town. It's about an hour north of the Minneapolis-St. Paul area. And I would say it is pretty small townish um, compared to living like right in the city. My mom lives right in South Minneapolis, so I'm visiting her often and kind of see the difference. And it's pretty rural out here, and then pretty city where she is. So just some differences there. But I do enjoy it. People are very friendly in Minnesota, so it's nice.
Mhm. Have any stores changed in your area?
Oh, sure. Um, Hours change. Definitely masks are mandated, wearing masks. Uh, Sometimes a few businesses have been shut down temporarily because maybe they had some employees or customers that contracted COVID. So they'll shut down either due to staffing or cleaning, things like that. So yeah, it it's changed a little bit.
Okay. So when you first learned about COVID in March, what were your thoughts about it? And like, how have your thoughts changed since then?
Yeah, I think it was. I think we were pretty. I think as a general population, we were pretty uninformed. There wasn't a lot of information out there about it yet. It was kind of scary. The unknown is always scary, and so yeah, we had to learn more about it. Uh, so at the beginning, I think we were really more apt to really follow rules and listen to what was being said and make sure that we were being very careful. And a lot of people were afraid to go out, I think. Um, so yeah, but I think that didn't last very long just because it got old and it was easier sometimes to think that it wouldn't happen to you. And so you would just kind of later not be so strict about the rules.
Mm-hmm. What issues have most concerned you about the COVID-19 pandemic?
Well, I myself am at high risk. I had a kidney transplant like 4 years ago, so I'm on immunosuppressants. So that scares me just because I do know that there have been a lot of people that have contracted COVID, and then if they have complications or have problems, it can affect your organs, and it has been known to affect your kidneys. And I received my son's kidney 4 years ago, so I want to make sure that I stay as healthy as I can and keep his kidney healthy since he was so um, selfless to give that to me. So, and then my family, I think, worries more about me than themselves. I think everyone else is pretty healthy, and I'm healthy otherwise. So, um, it depends on the time or the day or what's going on in public or what you're hearing. Depends on um, whether you're more concerned about it or not. Um, so yeah,
Definitely. Has COVID affected your job, and what ways has it done so?
yes, absolutely. Well, running a restaurant, so we were deemed essential employees right away. So because we were able to serve takeout and people could just come in and they could have not so prolonged exposure to people. You can come in and get your food made quickly and then leave so that you don't have that exposure. And then we have been mandated to wear masks. The employees wear masks. We are asked to have our customers wear masks. We have to stay 6 feet apart from them. Um, we try to stay 6 feet apart from each other, even as coworkers. Um, we have a lobby where people can sit and eat. And at the beginning of the pandemic, that was closed for I think a couple months. And then we were trying to reopen, and our lobby was open then for a while, for a few months, and now it's been closed again because the cases have risen pretty dramatically here in Minnesota. Um, so now we're back to just doing takeout, curbside, or people can come in and order, but yeah, they can't sit there. Um, so yeah, I'm trying to think of how else. I guess business wise, at the beginning, it did affect my business as far as how much sales we were doing, how many customers we were getting. At the beginning, I think probably the first week that it was really in the news and everything, we were down probably 70% of our sales. And then every week after that, it seemed like it just climbed another 10% as people kind of got more information and got more comfortable with it and got more um, used to wearing masks and what the safety precautions were, and that we started gaining like 10% a week. And then I noticed that we were the week that we were given, most people got the $1,200 stimulus, federal stimulus, right around the same time, within a few days of each other. And I noticed in the week after that is when our sales went back to normal. And even after that, they were probably above normal for quite a while. So now that the state has mandated another order to close some things down, bars and restaurants and things like that, it'll be interesting to see now with cases rising, how that'll affect customers and sales at our stores. It'll be interesting because we're one of the only restaurants that can stay open as far as, well, they can all do takeout, but some restaurants are more kind of probably prone to be ones where people sit down at. So I think we should keep our sales up. I think we should do well, which I feel very lucky for that because there's a lot of businesses that have had to close and can't even stay open even with takeout because they just can't maintain any sales like that. So that's unfortunate.
hmm Have you
Yeah,
had to change any of your employees, like how many employees you have in the building or not?
I haven't. Again, luckily because we've managed to keep our sales at a good level. I have been able to maintain the employee levels that I had before in the same hours. At first, we cut back our hours quite a bit, and that did affect my employees as far as how many hours they could work. But we haven't had to do that now. We only had to do that for maybe a couple of months, and then we were back to normal hours and normal sales levels. So I know that's, again, very fortunate because a lot of um, restaurants are having to lay people off. So
Yeah, definitely. What concerns do you have about the effects of COVID-19 on your employment and the economy more broadly?
yeah, that's the big issue with ha- trying to kind of balance the health of our community and keeping people out of hospitals, but yet we need to keep the economy going and people need to stay working or they won't be making any money, making a living. So yeah, it's a huge concern. Both, I mean, for me, because I own a restaurant, that's my income. I wouldn't get unemployment if my restaurant shut down. I wouldn't um, be eligible for that. So that's a big concern to me. And then obviously for the economy as a whole, that's a big concern as well because um, one thing affects another for sure. Because it was really interesting when this first happened, and a lot of things had been shut down for a couple months, and then we were having problems getting product because a lot of the suppliers that we have um, weren't open and weren't producing what they were before. So um, everything affects everything, it seems like. So any part of the economy, any business that is shutting down is going to affect everyone.
Definitely.
Hmm.
Has COVID affected the employment of people you know, like other people that aren't working for you?
Yeah, yep. My daughter and son-in-law are in the healthcare industry. They, my daughter's a dental hygienist, so at first they were shut down. So she was having to take unemployment. My son-in-law is a physical therapy assistant, and they were shut down. You couldn't be, in that close contact with people right away when we were first learning about how to how to protect ourselves and each other from that. So yeah, they were laid off for quite a while, for at least a couple months. Um, they luckily kept their jobs and then they reopened and they were able to go back to work full time eventually. So that was really good. But yeah, my husband's job at first, when everyone else was getting laid off, my husband's work was very busy. He was working overtime and they do land clearing and tree removal. And they were very busy because they were still working on the jobs that were pre-COVID. And then it was once everything started opening back up again, that's when they actually got slow because during the shutdown, that's when the jobs get started and the land clearing gets started. So yeah, his job has been affected as well, his business. So yeah.
Okay. Yeah. So how has the pandemic affected you and your family's day-to-day activities?
It just is, you can't go out as much. You have to find things to do at home. I think now that the winter season is here, it's getting tougher. When it was summer, we spent a lot of time on the patio. We even because this started in March, we right away bought a pool for our patio so that we could have a pool, just an above ground pool just to sit in and hang out in the summer. And that was really nice because then it could just be my husband and I and just sit in the pool and do that. But now, yeah, now that we have to be inside and there's nowhere to go or nothing to do, it's getting to us a little bit more because there's less to do outside. We're going to have to try to think of some winter activities, I think.
Yeah. So how else has it affected your communication with friends and family?
Yeah, yeah, that's been tough too. At the beginning of it, my father-in-law was sick. He started a second round of chemo, and it was sad. We weren't really able to go and see him and visit with him because we really didn't want him to be getting sick. And since he was at such high risk. So finally in the summer in um, August, we were able to go and at least visit. We sat outside and had a barbecue and social distance and did all that so that we could see him. And that was really a good thing because he ended up passing away like 2 weeks later. So I really feel for the people who are having issues with their loved ones in the hospital and they can't see them. They can't visit with them. So that's got to be tough. I can't imagine trying to deal with that. So
Mhm.
yeah,
Okay. Um, what have been the biggest challenges that you faced during the COVID-19 outbreak?
I think for me, my employee issues are always my biggest issue, even without COVID. But now with COVID, you obviously cannot any employee who has any cough, any fever, any I mean, obviously you don't let them work if they vomited or have a fever or anything like that normally. But normally, if they have a cold and they have the sniffles, they take some medication but you cannot let anyone work now if they have anything and then they need to go get tested. So that becomes an issue for staffing, definitely. Um, what else have been the challenges? Boredom, because there's not a lot to do, everything shut down. So we've done things like went and got takeout with friends and then went to a parking lot and sat in lawn chairs and social distance and ate our takeout because we just want to see each other or visit or have some communication and socialize a little bit, but you've got to be careful. So you have to find creative things to do like that and so you can stay safe.
That sounds like fun. So, how has COVID-19 affected your community, like your club, church? You said job before, but any other
Mhm.
parts of your community?
Sure, I'm trying to think of, I mean, it's everything. You can't go to sporting events. You can't anything where you're, together. We have in our city we have uh, street dances during the summer. Those were either canceled or you had to social distance, so that was tough. Um, it just really affects a lot of things that you don't even think of until they come up, and then so yeah, it affects a lot of things for a lot of people.
hmm So, how are the people around you responding to the pandemic?
I think everybody's kind of up and down and back and forth about it. It depends on where you're at the time and how it's affecting you. And it's been a pretty divisive, issue. It's become a political issue even. Um, I know a lot of people will tell you their views right out, and right away whether they're a Democrat or Republican because of how um, they are kind of seeing what's going on and their judgments. So yeah, what was the question though?
How are the people around you responding to COVID?
Yeah, so everybody's got their opinions. Um, a lot of people look at it very differently than I do. Um, some people are really against um, all the rules, all the mandates, um, not liking that they're told that they can't have a group in their own home. Um, and then other people are responding, by saying that we need to be careful like that. It just helps the whole community as a whole, not just yourselves. You need to think of everyone and how that affects our hospitals and how that affects our healthcare workers and how that affects everyone. So yeah, it's a hard balance to try to, you know, yeah.
Yeah, I get
I
it.
know I'm up and down too on it. Sometimes it's like I can't imagine people that are going out without masks or not worrying about it or not wanting to follow rules or whatever. But on the other hand, you want to do something you want to do and then you justify it by, trying to say, oh, it's not a big deal or whatever, because it's just easier. So yeah.
Mm-hmm. Self-isolation and flattening the curve have been two key ideas that have emerged during the pandemic. How have you and your family and friends and community responded to the requests to self-isolate and try to flatten the curve?
Yeah, I think that's what we've touched on, is that
Mm.
you you go back and forth on what your priority is depending on what you're looking for. If you um want to if you're working or whatever, you want to think about flattening the curve, you want to think about protecting other people. um but if it's going to be Thanksgiving on Thursday, and people are wanting to get together with their families and things like that, so then it becomes, well, mental health is an issue too, and self-isolating can be, a mental health issue. So you can kind of try to justify the risk of like having your family over, because it's something that would be too lonely or too hard to do if you didn't. So yeah.
Mhm. Have you or anyone you know gotten sick with COVID yet?
I have not. Luckily, nobody in my immediate family has. I did have a manager in July uh, tested positive for COVID, and that was the first person I had even heard of, um, through people or through yeah, through people or anyone I had known. And so that became an issue because she didn't know she was sick and was working. She thought she had allergies.
Mm.
And so then that exposed some of the employees. So we ended up having to close for a few days for safety and for staffing issues, because once you're exposed to it, you need to quarantine for 14 days. So there
Mhm.
were quite a few of us that had been exposed to her that couldn't work. So then we just shut down for a few days or whatever. Again, luckily I was able to do that without too many issues. And then um, the staff was very nice about that, about taking time off. They were fine with that. So
Okay,
yeah.
nice. Well, not nice, but you know.
Mhm.
I know you touched on this before, but what ways do you think COVID-19 is affecting people's mental and physical health?
Yeah, definitely. I think stress, the worry of it. Um, Everybody knows somebody, maybe a grandma or grandpa, or an elderly mom or dad, or somebody like me who's got health issues on the side. So if you're maybe not worried so much about yourself, you are probably worried about a relative or someone in your immediate family. And so then you worry that you're going to be the one that exposes someone else. So there's stress. Um, the loneliness, if you're in a household um, like my husband and I are empty nesters, so it's just him and I at home. Um, Luckily, that works out fine for us. And I can't imagine people with kids. That's got to be really stressful, because you don't get a break. You can't get away. And then they have all the school issues to deal with, because there's distance learning and there's in school learning. And what do you do with your kids if you got to work in their home? Or what do you do if you got to send your kids to school? Then they come home exposed to it. And yeah, there's just a lot of stress and mental health issues with this, for sure. And I just, in my opinion, we aren't a country that's well equipped for mental health issues as it is normally. So then to put this on top of it, I think that's just next to impossible to try to get that resolved with everyone and get everyone the help they're looking for. So yeah, that
Mhm.
worries me for
Yeah.
sure.
definitely. So what have been your primary sources for news during the pandemic?
Yeah, everybody's got their different story. There's a lot of information out there. Um, whether it's all factual, I don't know, but I really try to look for factual news. Um, I think because I own a business, my primary source is probably the Minnesota Department of Health. I look to that website, the CDC. I look to, and then as far as news, I try to look or if I see something that I don't know or that I doubt if it's factual or not, I usually try to go look under the Associated Press or Reuters or even BBC, just because I'm guessing that hopefully British news wouldn't play into our American politics as much. So I try to do that too. But it's hard. There's a lot of information coming at you, a lot of people telling you things, a lot of people have whatever their beliefs are. They have stats that back up those beliefs, and it's hard to judge first whether they're factual or not, and then also are they current or not, because we've learned a lot over the months. So maybe what they are talking about was true months ago and not anymore. So yeah, I think I really see how the public really finds and seeks out whatever facts kind of support what they already believe. So whether
Mhm.
they think it's from a hoax and all this is just a hoax to, this being the government, China putting this out purposely or something, there's so many different things, and I think people can find facts to back that up if they want. So
Mm.
that's a tough one. You really have to try to sort through it and try to be unbiased in finding out your facts.
Mhm.
Hmm.
Have you had to change what sources you look at, since the beginning till now?
Yeah, yep. Because I think before that, I always tried to do that too. I tried to go with trying not to watch politically biased news. Um, so I think I've done that even more so now and tried to go with more websites that I know have kind of a scientific view and are science based on their facts, and there's no maybe agenda for to try to get viewers or to promote anything. Um, yeah. So like the state website, just because they don't, they're just trying to get information out there. Um, so yeah,
Mhm.
definitely.
Yeah. Do you think there are important issues that the media might not be covering?
Probably. I don't know what they would be. I guess I try to believe that there are smarter people than me out there looking for those things and questioning those things and trying to get that into um, the media. Um, I'm not a big conspiracy theorist, though. I know there's a lot of people out there that believe a lot of really out there things, but I don't want to dismiss that either, because sometimes some of those things, there's some truth to any of those things. So you can't just blindly trust just what you hear on the news either, or just um, yeah. So yeah, that's a tough one.
Yeah. Okay, we'll just change subject here. How have leaders and government officials in your community responded to the outbreak?
It's amazing, I think, because um, from federal with the stimulus right away, I mean, that was fast. For a federal government to put out that money to everyone was quick. And then I was able to get a loan through the Small Business Association, get a loan for my business that really helped me. Back in May, I got that money. And then even city-wise, the state gave money to the cities and let them decide how to disperse that money. So had I needed it, I definitely could have applied for those kind of grants and things city-wise. And I got a lot of, I was really surprised at how good the cities were of getting that information to me as a business and making sure that I knew what was out there and what I could get for sure. So I'm glad of that just because I didn't need it as much, luckily, but I know there are a lot of definitely small businesses out there that needed that help more. So
Hmm.
yeah, it was good to see.
Nice. Do you have any thoughts on how local, state, or federal leaders are responding to the crisis differently?
Yeah, that's pretty divisive right there, isn't it? Yeah, I just wouldn't want to be in charge of it. I know that. I mean, the governor, our governor of our state, um, I think he seems like he's really trying to do what's right for our state. I think he stays really informed. If you listen to his speeches, he's very informed and very knowledgeable about the research, about the numbers, about the economy of our state, all that. I think he takes it all into consideration. But I think there's also a lot of people that don't agree with how he's handling it, and they don't like the state stepping in and saying, excuse me. But yeah, they don't like the state stepping in and mandating these things and telling us you can't get into a group of people more than 10. And now they're saying we can't even be with people outside of our household, um, in our own homes. And I think people don't like being told that either. But
Mm.
on the other hand, if there's people out there that aren't following the rules and their actions are affecting other people, what do you do? So yeah, I know, yeah, I would not want to be in charge of it. And then federal wise, excuse me, I'm going to take a drink of water here.
Mhm.
Um, Federal wise, I do wish they would have taken a bigger role instead of leaving it so much to the states.
Mm.
I think especially in the beginning when all the states needed more PPE and were looking for more help like that, I think if the federal government could have stepped in more and maybe centralized that more instead of the states fighting over all that stuff with each other, I think that would have worked better. But I don't know. Again, I always think there's got to be smarter people than me on top of this and the logistics of all that and trying to figure that out. So I try not to judge too harshly on that because, like I said, I don't. I'm just glad somebody wants to be in charge of that because I don't want to be. So
Yeah.
yeah.
Okay. Has your experience transformed how you think about your family, friends, or communities, and in what ways?
Yeah, I think because you realize you took for granted the freedoms that we have, the things that we can do. Um, as simple as one of the examples is for me is like my husband and I would go see live music all the time. And I really thought it was just something we did just because it's something to do. And now that we can't do that, I really like realized I took it for granted and realized how much we enjoy that and um, how much we get from that. So I think it does make you just really realize that time with your family, um, the freedom to see them, to hug them, to give them a kiss, um, any of those things, you realize you really take those things for granted. So it does make you think of things differently. What else
Mhm.
did you say? Did you think of differently?
Family, friends, and community.
Yeah. So yeah,
Mhm.
I think that covers it.
Yeah, that's good. So knowing what you know, what do you think that individuals, communities, or governments need to keep in mind for the future?
Um, I think we just need to learn from this. I love that this is, even like this documentation of this oral history of this is something that we can take away from because we're learning a lot right now with this pandemic. It's the first time it's happened in 100 years. So everything's changed so much that there's just no way to know ahead of time how that affects everything. But hopefully, by going through this, we can um, document this and see what worked and what didn't, and keep that in mind if there's other health emergencies like that. Prepare for other things. So yeah, I think it's definitely uh, just a learning tool for sure.
Mhm.
hmm
Definitely. Do you have any other topics or anything else that you want to share that I haven't covered yet?
Um, Let me think. No, I think that is
That's good.
good coverage of the issues that we're facing right now.
Okay, yeah. So that's all my questions I have for you. Thank you so
Okay,
much for doing this.
no problem. Good to see you.
Yeah, good to see you too.